uh, to Wellness Wednesday. His areas of interest include joint replacement, hip, knee, shoulder, elbow, and all forms of trauma and meniscal repairs like keyhole surgery. So, good afternoon, doctor.
Afternoon.
So this will be a fairly active session. Doctor.
Your audio is not very clear. I think I missed out on the last line. Hello? Hello?
Yeah, doctor, we can hear you. I think there's.
Hello?
Yeah, I think I missed out on the last line of the question.
Hello? Can you hear me, doctor?
Yeah, I can hear you now. Yeah.
Yeah. So, the first question comes from James Cordoza, who's asking, is osteoporosis reversible?
Osteoporosis is a silent disease. So basically, it doesn't give us any warning. So by the time you realize that you have osteoporosis, you are diagnosed with either a fall resulting due to which you land up with a fracture of your wrist, your spine, or your hip. So before you actually have a fracture, preempting the injury, it's like how we say prevention is better than cure. So we need to just investigate you first, pick up a diagnosis of osteoporosis, and then we start the treatment for osteoporosis. So because it's a very silent thing, you do, or you won't have like any other forms of arthritis, you won't have any pain or anything. You'll be well in yourself. So diagnosing it because of your age, perhaps. So there are two types of osteoporosis. So basically, you have a person who has the osteoporosis because of his elderly age group, we call senile osteoporosis. The second category is which comes in women is postmenopausal osteoporosis. So these two are different categories, and once you start having weakness in your bones and everything, which you will have like symptoms like bone pains and those kind of things, you investigate yourself. So for best thing for investigation for osteoporosis, we do is a DEXA scan. So once we do a whole body DEXA scan, we evaluate your hips, your heel bone, your wrist, and your spine. And we look for a T-score. So once based on this T-score, we get to find out whether you are having a weak bone or your bone strength is normal, your bone mass. So based on that, we find out whether you're thing. So that's basically how we go about diagnosing the problem. And once we find that you're having a weak bone, then we start treatment.
Okay, thank you, doctor. The second question is from Atul Patil, who says, I have facial pain while running and pain in left scapula as well.
What pain? What pain do we have?
Facial pain.
Oh, shin pain. Okay.
Yeah.
Shin splints is something which is a very common problem which occurs in runners. So if you start training for any kind of marathon or any kind of long runs or anything, if you are not accustomed to running for a particularly long period of time and you start suddenly, then the chances of getting this shin splints is very high. So basically what a shin splints is, it's an inflammation of the covering of the bone, which we call the periosteum. So that can get inflamed because of unaccustomed workload. So if at all you're going to do any kind of running or anything like that, you slowly build it up. If you start having pain, always what we say is to reduce the intensity and take some anti-inflammatories, then slowly build up the strength of your bone, and then you start running again.
Okay. The next question is from PT Srinivasa, who says incomplete fracture at lower shaft of fibula with associated narrow edema and surrounding soft tissue edema, likely stress fracture, mild ankle joint effusion.
I gather from the history, I think probably he's twisted his ankle and he's probably had a kind of a small hairline fracture over there. But usually for distal third fibula fractures, which are having marrow edema and if it's undisplaced, normally I would suggest, if you have seen the orthopedician and he's advised you, what I would suggest is at least 4 to 6 weeks of rest. If the rest kind of part is taken care of well, then the rehab afterwards is very easy. But if you don't take rest, if you have a fracture and you still hobble on your foot, then the chances of you having a chronic pain later on is much more higher. So rest is the key. So once you take rest, then the pain is going to go down. Once the pain goes down, then you should be able to rehab yourself after that.
Thank you, doctor. The next question is from Sunil Luthra, who says, when he sits and gets up, there's some sound coming from his knees. So
from his knees. Okay. This is a very common question which we get. Okay, the knee is a very complex joint. Okay, so each time you bend and get down, your knee does not go in one direction. It actually twists and then you get up. So each time you twist, because you have got a lot of ligaments and you got some menisci and you have the collateral ligaments and other structures, there's always some kind of freakiness which can happen again because of the kneecap also, which glides up and down over the thigh bone. So because of these multiple movements within a small enclosed space, you do get noises. As long as these noises are not painful noises, you don't need to worry about it. If you start getting painful noises, then we start investigating it to see whether you're having any kind of a cartilage problem or whether you're having any kind of a joint problem like arthritis. So as long as there's no pain, there's no worry.
Okay. The next question, doctor, is about a chronic knee pain a 34-year-old has. He has a chronic knee pain, and the only solution is if he wears a kneecap, or if somebody, if he puts weight on his leg, the knee pain reduces. Is that a good practice, or is there anything else that you could do? And is it an early sign of arthritis? And if it is, how to get it solved?
34-year-olds with knee pain is a very common problem. The reason why I'm saying is because at this stage, if you don't look after your knee, then the chances of getting wear and tear and arthritis is much higher. The fact that he's having knee pain is because there is some kind of a problem going on, most probably in the cartilage. So it could be either the meniscal cartilage if he has been into any kind of sports, or it could be because of the articular cartilage, which is the cartilage surrounding the joints, if he has been loading his joint abnormally. So what we need to see is the causative factor for the pain. We need to see his lifestyle, whether he's doing too much of stairs, whether he's sitting cross-legged, whether he's doing yoga, whether he's doing those kind of knee bending activities. And basically, if you take off the source of the pain, so basically you try to avoid the cause of the pain, then usually the cartilage problem settles down. However, if it is a mechanical problem like a meniscal tear or something which can be according to injury, we need to look into it through a keyhole procedure to sort it out.
Okay. The next question is, my issue is left leg pinched nerve and right leg knee pain at night.
Left hip pinched nerve and right knee pain.
At night, yes.
Only at night. Okay. So I think probably the most common cause of people, especially youngsters, having pain in their hips and people having some symptoms of sciatica, which I think is the reason why he's saying pinched nerve, can be because of postural reasons, mostly because of prolonged sitting. If a person is able to bend down comfortably and without any assistance touch the floor, the chances of him having a sciatica is ruled out. Usually they will not have any kind of a sciatica pain. The fact that if he's having a pinched nerve or if he's having any pins and needles and tinglings going down his leg, that could be because of just temporary pressure because of prolonged sitting or prolonged activity. So if the prolonged activity is actually kind of taken off, then that part of the thing will actually kind of go off the picture. So if it is a prolonged symptom which is disturbing him, then obviously we need to investigate it with higher investigations. The best way to look for a pinched nerve or a disc would be to get an MRI scan. X-rays are a very kind of a basic investigation, and unless you have a fracture or any kind of a spasm in your back, which we can see by the curvature of the spine getting lost, we can't see anything decipher anything from a plain X-ray. So if the pain is so bad and it's nagging, then we have to get a higher investigation. If it's not too bad, then it's postural, and most probably it will get better with physiotherapy.
Okay. So we have got some questions in the chat box as well. So Hardik says, hello doctor, I have lumbar discogenic backache. My age is 38 years.
Okay. But as I was telling you just now, with regards to lumbar discogenic backache, the problem lies mainly in posture. So if you are correcting your posture and getting adequate rest during your work period, so by that I mean if you are having a desktop or a laptop, make sure that your screen is in parallel with your eyes, okay, or probably a 1/3 up and down. So if you keep that level of thing, then you don't strain your neck and the back. However, if for a prolonged period of time you're in a bent posture and you're looking down, then always the chances of you developing neck pain and back pain is much more higher. I normally say that everybody should take at least a break every half an hour if they are sitting in front of the system. And even when they get up in front of the system, in your chair, there's always chances of doing exercises. So you need to do a lot of stretches in your work period. So every half an hour you get up from your chair, you take a short stroll, come back, do some stretches for your upper back, and then sit down and do your work. By that, you can just take away your back pain. If the pain is so bad that it's disturbing you, I think, and after the investigations, if the investigations haven't shown any kind of a big disc, we do have procedures which can actually alleviate your back pain. We start off with medications first. We start you on a course of physiotherapy. And if it doesn't get better, then we have procedures like epidural steroids, which is a very safe procedure. And usually that kind of takes away the thing. It's like just lubricating your back. So by doing that, most of the people are actually able to go back into their regular lifestyle.
Hello, doctor.
Yeah.
Is jogging is the best exercise for this pain, which I have raised?
You need to do physiotherapy for your back. You need to do core strengthening exercises. Jogging is a good aerobic exercise. It will improve your lung function. It will improve your cardiovascular health. But for your back, what you would need to do is you need to do specific exercises like core strengthening exercises, and that will help your back get better.
Okay. Okay. Thank you, doctor.
Okay. The next question is from Pankaj Jaiswal, who says, I'm 35, single, and my left leg pinched nerve. The same question which I already asked, sorry. Anish Desai. My question is,
Hello?
what kinds of foods we
Hello?
should include? Hello?
Hello, ma'am. Hi, ma'am. Actually, that pinch nerve. Hi, ma'am. Actually, the pinch nerve as a pain at night, not a day, is only a night.
Yes.
And the left knee also the pain, and the same time maybe as approx 2 to 3 p.m. at the night.
Yeah, Pankaj, I did get your thing. Look at if you have symptoms which are disturbing you and awakening you from your sleep, I think what we need to do is we need to look at your posture in a lying position. So probably you are lying down in an abnormal position and it's getting aggravated at that particular period of time. Try sleeping with a kind of a pillow underneath your knee, and that will kind of take away the pressure that should help you with regards to your thing. If it doesn't help, then probably I think if you can drop by anytime to the hospital, we can check you out and then probably make sure that there's nothing else which is causing you any kind of discomfort.
Okay, sir. Thank you, sir.
The next question is from Anish Desai, doctor. He is asking, my question is, what kind of foods we should include in our diet to avoid osteoporosis?
Yeah, that's a very good question. Because it's a silent disease, you need to keep yourself very healthy. All kind of milk products are very good for the bone, but if you take milk products, the chance of getting a high cholesterol is also there. Obviously, you need to take semi-skim milk if you're into thing. Cheese and paneer and soya is a good alternative. The other things you can add is a lot of nuts into your food. You can have a lot of green leafy vegetables and avoid excess of water. You drink a lot of water, there's always a tendency for passing more urine. And if you go to the loo more, then the chances of you depleting your calcium is also very high. So you drink adequate amounts of water, but not too much of water. Coffee, not more than 3 cups of coffee is advised, because coffee also has a bad effect on your bone mass. And along with that, the same thing holds for salt. So you reduce your salt, reduce your coffee, and control your intake of water. And if you and obviously I would say alcohol and smoking is bad, but if you take alcohol, then don't drink too much, because that also has a deleterious effect on your bone.
Okay, thank you, doctor. The next question is from Subaya. He says, I'm 59 years old. I have pain in the back of the thigh, below the hip, more on the right side when I go for slow jogging. It is minimal pain, but I want to be careful. But when I play tennis, I don't have this pain. Second, of late, I find it is difficult and painful when I have to go on the floor to do any work, say reaching the lower shelf.
From what I gather, Mr. Subaya, it looks like you're having some kind of problem in your low back, because when you're bending down, you're having pain. So it comes down to the same kind of problems which I was mentioning before about discogenic kind of back pain. So what I would say is, since the fact that you're able to play tennis and other things well, it looks more like a postural thing. It doesn't look like a structural abnormality. So what I would say is, for you also, I think if I don't know your age and I don't know your weight. So, but I would say keep your
Doctor, his age is 59 years.
59. So
Yeah.
if for 59, you're able to play tennis and you're able to get along. So I think with most of your activities, I think probably you should be having some kind of a mild wear and tear going on in your spine. Doing a fair amount of exercises to improve your your back strength should kind of help you alleviate the problem and go ahead with your.
Doctor, can I come in?
Yes, sure.
Doctor, it is, I'm quite flexible, bending, doing all those exercises, warming up, stretching, and I don't have any problems. It's just that when I start jogging after a proper warm up, I find that there is a sort of a very warm pain. I wouldn't say it's a very, on the right hand side. I'm worried it should not be anything to do with the hip. That is my main worry.
Are you able to do a full squat, sir?
Squats?
Yeah.
Yeah, I can do it.
If you're able to do a full squat and get up and you don't have any kind of problem in doing that, it's very unlikely to be coming from the hip. But the fact that you're having pain only when you're jogging or after the thing, then I think probably it could be something to do with the muscles around your back. So what I would suggest is probably if you strengthen the muscles around your back, then the chances of that pain which you're having, especially when you're saying like when you're bending down to take some things from the lower part of the shelf, those kind of tingles will go away.
Thank you, doctor. Just a clarification on this, doctor. When I say bending, I could just pick up anything from the floor. I'm very flexible. I'm not, but when I bend my knees and go down on my knees and pick up something, I find it a little difficult to get up. I'm not very heavy. I'm around 72 kilos.
Okay. Like how I said,
yeah,
the fact that you're able to do most of your activities, it points down to not a structural problem. It's more of a postural kind of a problem for you. So I still think you're very healthy, but I still think that you need to work on your fitness for your back, your core strengthening and other things. So if you strengthen your back, then that kind of symptoms which you're having will also go away. Obviously, I need to cast an eye on you and then have to examine you before I can actually put my pen onto paper. But I think this is from what you're speaking and from what you are telling, I think it's more like not like a serious problem. Have I answered your question, sir?
Yeah. Okay, I guess you have. So,
thank you, doctor. Can you hear me?
Yeah, I can hear you. Yeah.
Thank you, doctor.
Yeah, thank you.
Yes. The next question, doctor, is For playing cricket, can we put kneecap for long duration?
Now, there's nothing wrong in wearing a kneecap for additional support for your knee. So if you're playing cricket or any other sport for that matter, if you want additional protection, having a kneecap is a good thing. But yeah, so if you're kind of into any kind of sport where there's too much of knee bending, a kneecap would not be advisable.
Okay, doctor. I guess that answers the question that Satish had. The next question, doctor, is from Bandita. She says, I'm 40 years and have back pain on my left leg running down the whole leg. I showed it to a doctor. He said I have nerve bulge and plantar fasciitis. But recently the pain increased and I have to take painkillers.
Okay, there are two problems from what you're saying. One is you're having a low back pain, which is probably radiating down your leg. The problem could be related to a sciatic nerve, or which, like how they are saying, how it could be a nerve impingement. The second thing is you're having a problem in your foot, which we call plantar fasciitis. The plantar fasciitis is a very common problem. I have talked about this back problem quite a bit now. So I'll just explain about this plantar fascia. If my hand was the foot, the plantar fascia is actually a band which starts from the heel and goes like a fan shaped and goes to all the toes. If you're having a tight plantar fascia, it pulls on the heel bone, and because of this tight pull, there's inflammation in the heel bone. And what happens is, because of the inflammation, you have pain. This comes in mainly people who are not into too much of exercise, or in people who are overexerting themselves. By that I mean poor footwear and walking long distances. So it boils down to two things. One, you have to make sure that your foot muscles are all exercised properly. So by that I mean standing on your tiptoes, standing on your heels, those kind of things. Wearing the proper kind of footwear. A soft, cushioned chappal usually takes away the pain. However, if it's a persistent problem, then we need to do some intervention for it. By intervention, I mean, if the pain is so nagging and you're not able to wear your shoes or not able to take few steps in the morning, and it's a recurrent thing which affects your day-to-day activity, and you're not able to do it, then we do an injection, and during that injection procedure, we kind of take away the tension from the plantar fascia, and that normally relieves the symptoms of plantar fasciitis.
Doctor, can I say something?
Yes, please.
Okay, after I have a sitting job, so after sitting for long, like I used to go out for a walk just for 5 to 10 minutes after first few minutes, but still then when I wake up in the morning, I cannot put my leg. I need another 15 to 20 minutes to stand. And then I do the exercise in my bed, then only I can stand. And this back pain is increasing so much that I have to take painkiller or Dolo 650 because painkiller is causing acidity. So now I have mostly weekly, once or twice I am taking Dolo 650. So is the back, this sciatica nerve or back when I am doing exercise, 1 hour exercise continuous, 6 to 7 or anytime in the evening or in the morning, but still it's not going. So is there any way we can maintain this? Because I think it's not helping me out and all the medicine is not helping me out.
Yeah. So the thing is, from your back problem, what I'm saying is regular exercise, what you're doing will help you. For your foot problem, we have to look into it because taking Dolo 650 3 times a day is very safe. You can take it as much as you want. With regards to your foot, what I'm saying is because you're having pain, which is going only on exercise, I would say that you're having a tight plantar fascia. We need to take an X-ray first to see whether you're having a calcaneal spur. Only by doing an X-ray, we'll have a look at it. We'll be able to see that. Once we've done your X-rays and we see there's a calcaneal spur and you have a tight fascia, we have to start you on a course of physiotherapy, which will involve ultrasound therapy to the heel, or we might have to put you on some laser treatment. And once The physiotherapy is done and you still have pain and your footwear has been altered. In spite of that, if the pain doesn't go, then we have to do some intervention. Okay.
That answers your question, Bandita. Thank you. So the next question, doctor, is from Priya. She says, is vertigo to do something with the neck bone? I have a tendency to read books with my neck in an irregular position. The ENT says it's ear bone. Can you please suggest?
Vertigo can be because of many reasons. Very rarely because of your neck problem. It's mainly because of the ear problem, because in your ear you have semicircular canals, and these semicircular canals are the ones which maintain your balance. So if these semicircular canals are disturbed because of any reason, it might be because of travel, it could be because of abnormal lying down, keeping your head in an abnormal position, abnormal sounds, anything can causing disturbance can cause vertigo. And usually this positional vertigo usually is cured with medications. I'm saying positional vertigo, not anything which is related to any kind of lesion involving the ENT. Okay.
Okay, thank you, doctor. The next question is from Venkat, who says, my age is 32 years and my weight is 82 kgs. While doing bending exercises, I feel back pain and it remains for 2 days. Sometimes knee pains also occur.
Yeah. If you are having back pain related to exercise, then normally the pain lasts for a day or two. So that is a natural thing. However, if the pain is abnormally large and it prevents you from doing activity, then we need to look into it. So I think if it's a natural phenomena for any person who is exercising to have some kind of a discomfort or pain when you are doing your weights or anything, or if there's any kind of you're doing it and you're increasing your workload.
Okay, thank you, doctor. Pooja Narang, I have just today and I'm having severe pain in feet and legs. Pooja Narang, if yourself what?
Hello, namaste ji.
Yeah.
Recovered yourself from?
Yeah.
Namaste, Dr. Saab.
Yeah, good afternoon. Yeah, tell me.
डॉक्टर साहब ये कोरोना के बाद ना मैं सो नहीं पा रही हूँ, ना दिन में ना रात में, 3-4 बजे के बाद जाके नींद आती है और इतना पेन है। ये जो हमारे फीट की जो फिंगर्स है उनके नीचे वाले पोर्शन में सिवियर पेन है। मैं ऑइंटमेंट लगाऊं, दुपट्टा बांधूं, कुछ भी करूं, अनबियरेबल है वो पेन और नींद भी नहीं आ रही। और हमारे हिप्स में जो जॉइंट की जो प्लेस है वो लेटने के कारण 15 दिन 16 दिन में लेटी रही, शायद इसलिए वो बहुत पेन भी है वहां बोन में।
So did you have corona?
Yeah.
Okay.
Today is my 17th day.
Okay. So what I would suggest is, look here, there are a lot of post-viral sequelae of corona. So one of it is joint pains.
Yeah.
Okay, so what I would suggest is, if the pain is persisting for long periods of time, one thing you need to see the medical doctor who is seeing you, just to make sure that it is a sequelae of corona. If it is not a sequelae of corona, and if it's not been there before, then we can actually kind of look into it in terms of a general joint arthralgia, for which we normally start you off on painkillers and give you some anti-inflammatory medications.
Okay.
One thing I've seen for people who have had corona and who are having joint pains is starting off with a mild anti-inflammatory medication for a period of time. So probably I would say at least 4-5 days of anti-inflammatory medication will normally take away the pain which is affecting your joints.
Okay. Thank you, Doctor. Thank you.
Thank you, Pooja ma'am. The next question, doctor, is from Ramaswamy, who says, my mother, who is 83 years old, is having pain swelling in both the hands and fingers and is not able to move both the shoulders.
Okay. The fact that she's having pain in the hands and fingers would correlate to two things. It could be either because of osteoarthritis, which is the more common form of arthritis, or it could be related to rheumatoid arthritis, which is a condition which affects all the joints, and but mainly the small joints. The fact that she's having shoulder pain also suggests more in terms of something like a periarthritis shoulder. So it's more in terms of arthritis. So if she's unable to lift her hands up or reach her back or anything, it's frozen shoulder, for which we normally suggest intense physiotherapy first. If the physiotherapy doesn't work, then we actually kind of give them injections in the joint to take away the pain and put them again on a course of physiotherapy. If it doesn't work, then we do something called manipulation of the theater to get them back to full function.
Okay, I guess that answers his question. The next one is from Nupur Gupta. She says, my mother is 3 years old. She's suffering from osteoporosis. She's taking supplements of calcium and vitamin D3. She's unable to stand in the morning and has numbness in right leg due to pain in tailbone. Please suggest.
Yeah, I think tailbone pain is something because of prolonged sitting down. So I think the numbness can be because of multifactorial. It could be because of vitamin deficiency. It could be some people who have diabetes. Those people can have numbness in the feet. So what I would suggest is, considering if they don't have diabetes, I would treat it as peripheral neuropathy and put them on a course of medications for the nerves, just to strengthen the nerves. And for the tailbone, I would offload it. So probably not sitting down for long periods of time in a hard stool or those kind of things, and just we have circular pillows called donut pillows. So if they sit on that, that'll kind of offload the buttock area, and normally the pain goes away.
Hi, Doctor. Nupur this side. Sorry to interject. Thank you for the feedback. And I just want to check that what exactly are the medicines which my mom should take for the osteoporosis, because right now she's on Supercal meds from last 5 months. And I think there is no improvement which is shown by these meds. So what medicines she could take for this?
No, has she had a bone scan? You cannot, if has she had a DEXA bone scan?
Okay, bone scan you are saying.
Yeah, she needs to have a whole body DEXA bone scan to get the diagnosis of osteoporosis first. So what she's taking is just a calcium supplement, which we normally give for people on a blank thing for people who have postmenopausal osteoporosis. We put them on calcium and vitamin D3, because vitamin D3 helps in absorption of calcium, and that helps to keep the bone strong. However, we need to quantify the osteoporosis, if at all there is osteoporosis. For that, we need to do a whole body DEXA bone scan. So once we do a DEXA, then we'll know whether she's osteopenic or osteoporotic, or she's having normal bone strength. And based on that, then we can start the treatment.
Okay.
Thank you, Nupur. Doctor, the next question is, what can be done to treat L5 disc prolapse? He is 59 years old.
The thing is, I need to have a look at the scans first, if at all there is disc prolapse, because sometimes based on the reports which say disc prolapse, on the scans when we see it, it might be just a disc bulge. So we need to have a look at the report, the films first. If the films are actually showing disc prolapse, then we need to see how much the pressure is on the nerves. If the pressure is not too bad, then we can try out injections for the spine. We can do nerve root injections. We can give a course of epidural, give a shot of epidural also along with the same thing, and that usually takes away the inflammation from the nerve root. In that way, without doing surgery, we are able to alleviate the pain. However, if it's a large disc which is pressing on the nerve quite badly, then we have to do something like a microdiscectomy to take away the nerve which is pressing on the nerve root.
Okay, adding to that, there's one more question which has just come in regarding that. What is prolapse? Because I'm having problem in L4, L5.
Prolapse is actually, the disc prolapse is actually if you take a look at the spine, in between the bones, you have a cushion. And this cushion actually kind of helps hydrate the disc space. And once the cushion, the cushion is like the disc is actually like a, if I drew an analogy, I would say something like a donut or more like a tire. And if the rim of the tire is torn, then the material inside can bulge out. So if the tubing of the thing can bulge out, then that is called that is similar to a disc prolapse. So if this tubing kind of thing bulges out and presses on the nerve root, then you have the shooting pain going on your leg.
Srinivasan. Okay, I think, okay. Let's get to the next question then, doctor. I'm Uma, age 55. I recently started playing badminton. Suddenly, I'm not able to pick up a water bottle with my right hand. The upper forearm below the elbow hurts. I have now stopped playing badminton for the last 2 weeks, but the pain is still there.
I think it started off post playing, and in spite of resting, you're saying that the pain is still persisting. We need to see whether you're having any kind of overuse syndrome, because sometimes when you start hitting like this and all, then you can, and you obviously you stop playing the game, but you still, I'm sure, are doing some work at home, like lifting things and those kind of things. So if that is the cause, then probably you might have something like an epicondylitis, which is probably causing pain going down your forearm. So we need to examine you first, make sure that is thing. So it's something like an overuse injury. So once we put you on, evaluate you, put you on some rest, anti-inflammatories, physiotherapy, that might take away the pain.
Okay. So, doctor, the next question is.
Thank you, doctor.
Thank you.
Thank you. So the next question is from Pradeep Jain, who says, my wife is suffering from arthritis. She got severe swelling in both knees. Can we send to you over email the photos thereof? Is his question.
Yeah, sure. You can send it by email. I think Sashwati has my mail ID. So I'm happy for her to share it to you. You send all your images, I'll have a look at it and I'll tell you what's the best.
At the end of the session, I'll share doctor's details with all of you. So if you have any queries, you can email him at any point of time. He would be willing to answer those. So the next question, doctor, is bilateral retrocalcineal bursitis. Is there any treatment other than surgery?
You need to change your footwear first. Okay, so first thing is footwear change. I think they say that this is called heel pumps. Okay, so if people who don't know what that is, it's basically behind your heel bone where your tender Achilles sits. There is an overgrowth of bone, and that kind of presses on the tendon. Because it presses on the tendon, the cushioning in between the bone and the tendon gets inflamed, and that is called the bursitis. So normally we do an ACAP procedure for this, and that is the surgical procedure where we actually kind of shave off the extra bit of bone which is pressing on the tendon. Because you don't want surgery, the only other way forward is something external. So that would be physiotherapy and a raised footwear, something like a little bit of heel, and that could kind of take away the pressure from the tender Achilles.
Thank you, doctor. So the next question is from K. Subramanian, who says, my spouse has pain in her left heel for the past 2 months. She is not diabetic. Please suggest a non-surgical method for this condition.
So this is what I was saying about plantar fasciitis. Non-surgical treatment is doing a lot of exercises for your foot, change of footwear, and physiotherapy.
Okay. Next question. After spine operation, feet and fingers motion are slow, and left side of my body, hand and legs cannot take weight.
I think you need to ask your surgeon
Okay.
there.
So the next question again.
I'm just joking. I'll tell you, if you have had a surgery and everything has gone well, I would suggest you to actually spend more time doing rehabilitation.
Okay.
So I think you need to do more rehab, and by doing more rehab, you should be back on track.
Okay, doctor. Thank you for that. So the next question. Looking at a problem of everyone shared here, and I also shared my problem of lower back pain, what all precautions should be taken going forward for any kind of major bone problem?
This is a very good question for many reasons. Why? Because I think she...
doormats
Ma'am Renu Gupta, I would request you to mute yourself.
Yeah, so basically what I would suggest is you need, for good bone health, what you need to do is, one is eat healthily, exercise regularly, uh, keep your weight to a normal that is within your BMI, and have adequate rest. Because if you don't have rest, then you can't exercise the next day morning. So if that thing, that cliche comes back, early to bed, early to rise. So that's a very good thing. And make sure that you finish off your dinner early. So you need to finish off your dinner by 6:37.
Okay, that's good advice. Okay. The next question is, my bones are weak. It is less than minus 3.50. Severe osteoporosis. I started calcium. It resulted in stone in kidney. I'm concerned on spine because problem has crept in L4, L5 at the moment.
Yours is a frank case of osteoporosis, and calcium is not the treatment for it. For you, you need something which is a more aggressive form of treatment for the osteoporosis, because the chances of getting fractures, silent fractures, is also very high. So what I would suggest is, if you are if you are anywhere within a vicinity, you can see an endocrinologist or an orthopedician. The way forward would be to start you on injectables. So you need have 6 monthly injections of denosumab. I have actually put out a thing on my thing on osteoporosis. You can look at the video, and I have said that there are different methodologies of treating osteoporosis. You start off with you can have tablets, weekly tablets or monthly tablets with 6 monthly injectables. So this is the best way forward for treating severe osteoporosis. The recommendation from the from the US FDA is to start treatment with Terifrac, which is teriparatide, which is a recombinant hormone, for 2 years first, and then go on to 6 monthly injections. So that's the US FDA, but the recommendation. But because people find it difficult taking the injection daily,
Okay. Doctor, the next question, which I would like to ask is about food again. Somebody has asked, what are all the vegetables and fruits which help improve the calcium level?
vegetables are all green leafy vegetables, and as I said, nuts and green leafy vegetables. That's the best way.
Okay. Nuts. Sure. So the next question, I have developed meniscus tear grade 2 injury on my left knee. Got my MRI done on 20th March. Since then, I have stopped running, which is my passion. I want to know by when can I resume my running. Doctors at Kota asked me to resume after 8 weeks.
Okay, you need to be able to do a full squat before you actually kind of get a thing that your meniscus has healed. If you're unable to do a full squat, that means your meniscus hasn't healed. So if once you are able to do a full squat, and then I would suggest you to start off your running. However, if it's still paining, then I think we need to look inside and make sure that.
Okay. Following the question on vegetables and fruits that you said, somebody has asked nuts and what? I didn't hear properly. Please let me know.
Green leafy vegetables, nuts, and if you're vegetarian, I would say paneer and soya and the other things. Yeah, but any kind of if you're non-vegetarian, any kind of protein, good protein kind of like chicken and mutton, everything helps you.
Okay, doctor. So the next question is, I am having bearable pain on the middle of right back, closer to the spinal cord. Sometimes it radiates down to the lower right hip. I have a 3 mm stone in right kidney. My family doctor says by taking plenty of water, the stone will go off. And this is not the cause for the pain. The pain is bearable but nagging. Suggest.
If you have a back pain which is related to your renal stone, then the pain usually goes down to your groin and reaches your urinary tract. However, if you have pain in the back, which is nagging, and if you have seen a urologist and he doesn't think that it's because of the thing, usually if it's a stone which is embedded in the kidney, it's very unlikely to cause the pain. Only a moving stone causes pain. So what I would suggest is probably strengthen your back, get your back posture, everything corrected, and that should take care of the thing. Drinking plenty of water will take away the stone if it is anywhere mobile in the track and it's less than a few millimeters. Anything more than that, it's very unlikely to move.
Okay, doctor. So the next question we've got in a chat box is how to fix slouching, more of a lifestyle habit.
Don't have any bean bags or kind of sofas which are very low level. That because if you have that, then the tendency to lean back is very high. Having a firm chair, especially in your workplace, is very good. You should also have a chair which can move up and down, in which way you can adjust your height in front of your computer screen.
Okay. So the next question, doctor, is how long does a fractured bone take to heal?
Depends on which bone is fractured. If you have a fracture in your upper limb, I would say anytime between 4 to 6 weeks. In any time in the lower limb, it's double that.
Okay. Next question, doctor. Diffuse disc bulge and disc desiccation with anterior corner end plate changes and ligamentum flavum hypertrophy at multiple levels.
That's an MRI finding.
Okay.
We need to see the MRI to discuss the thing, but it doesn't. Disc desiccation, it means that there is no water in your disc.
Okay.
Bulge means that there is just your disc is just bulged out slightly. So based on what that is saying, though it sounds very complicated, it's not something to worry about.
Okay. So is there a good supplement we can take since we're lesser exposed to sunlight and kids have less physical activities, or women because of a new normal? Are there any supplements for bone strengthening? I guess is what you want to ask.
Yeah, supplements. There are a lot of supplements nowadays. So what I would suggest is, if for children, the best supplements would be to take healthy food and supplement them with all these nuts and give them milk and all the other things. For women also, I would say the same thing, because one thing if you're in the premenopausal age, then there's always taking hematinics to improve your iron content. Those kind of things will be very good. And if you're in the postmenopausal age group, then I would say taking a lot of calcium supplements with it.
Okay. So the next question, doctor, is from Ramarao. Recently, I suffered with lower back lumbar. For this, I'm using the medication of nearly 20 days. Should I continue or can I stop the treatment?
Too much of painkillers is not good because you can develop gastritis. It can affect your kidneys. But if it's just a muscle relaxant, I don't think if your pain is gone, you can stop it and then go on to physiotherapy and exercises. But if you still have back problems, then you can nothing wrong in taking a muscle relaxant.
Okay. So yoga, there's a question on yoga here. Are there any specific yoga exercises to treat back pain?
Yoga is good for flexibility, not very good for the knees. So I'm not a big fan of yoga.
Okay. So the next question, doctor, is from Bharati, who says, my lower backbone from left side pains, and due to that vibration, it goes to the whole leg. Something to worry about?
Back pain.
Yeah, lower back pain.
Yeah.
Both from left side.
Low back pain going down your legs. If it's not causing any numbness, tingling, any problems with your bowel bladder, I won't worry about it.
Okay.
The problem would be only if you have tingling, numbness, weakness in your legs. So just pain going down your leg, I would strengthen your back, do exercises, and then get the pain out.
Okay. So there is one question, doctor, very general question, but very important. So swelling of legs and feet, why does it happen or how to avoid it? What are the causes?
Swelling of the legs and feet can be because of many causes. The chief causes for swelling, because from an orthopedic point of view, I get it many times, because when I put a bandage around the knee, they come with leg swelling. That's because your venous return has been shut off. So once you take off the bandage and you change the position and put it from the feet upwards, then the swelling is gone. However, if you have an elderly person with feet swelling, that can be because of renal problems. It can be because of cardiac problems. If the person is unable to do stairs and they are able having foot thing, then we call it congestive heart failure. If it is because of a renal problem, then the renal is not the thing. It can be because of a reduced oncotic pressure in which they are not able to hold the blood within the intravascular space. So it becomes dependent edema. So there is multifactorial. So once we see the patient, we are able to analyze what's the cause.
Okay, doctor. So the next question is from Ashok Kedia, who says, I fell down and broke my left ankle. I had to go for surgery. The doctor put the plate and 4 weeks plaster. Now I can't straighten my hand. The doctor has advised to keep stretching my hand as much as I can. Whether you advise any other exercise?
Ankle or the hand?
Left ankle.
Hand.
He says, but after that, he cannot straighten his hand now. And the doctor has advised him to keep stretching his hand. But he wants to know if there's any other exercise he can do to get it back.
Wax therapy. So meet the physios, and then he can do wax therapy. That will help to get the movements better.
Okay, here's a question on knee joint pain, where this one person says he has constant knee joint pain for the last 6 years. So that is the only.
Yeah, if he's a young person, then as I said, it could be softening of the cartilage. If it's an elderly age group, then we need to take an X-ray and rule out arthritis. That's based on the diagnosis, then the treatment varies. So if it's a younger person, then we ask them to avoid all knee bending activities and put them on supplements. If it's on the elderly age group, then we ask them to take supplements and then we have to give them joint lubrication. If that doesn't work, then we go for surgical procedures, if at all it's.
Okay. So the next question is, even after left knee surgery, my patella is making sound for every step. So
yeah,
is it like
replacement? Sometimes you do get clunking noises in the knee. As long as it's not a painful clunk, I wouldn't worry about it. However, if it is getting painful, then we might have to look into the cause.
Okay. Doctor, the next question is, routine foot massages and reflexology for senior citizens, is it advisable? Stuck.
Yeah.
Yeah, doctor.
Hello.
Okay, yeah. Can you hear me, doctor? Hello? Hello? Doctor, we are not able to hear you. Hello, doctor? We're not able to hear you. The audio is not coming. I think you should, you're on mute.
I've taken off the mute thing. Yeah, is it okay?
Yeah, yeah. Now we are able to hear you, doctor. So the question, should I repeat? So it was on foot massages and reflexology for senior citizens. Is it advisable?
Foot massage reflexology would be advisable because it kind of improves the circulation in the foot and also takes away the pain which can come from plantar fasciitis.
Okay. At any age group, doctor, for senior citizens?
Any age group should be perfect.
Okay. Then there is one question on diet to prevent arthritis.
Diet.
To prevent arthritis.
There's no diet to prevent arthritis, but if you keep your diet less and you keep your weight less, then the chances of you developing knee pain is also less, because if you see by the thing like the force per unit area square, I think the thing, so you reduce the force which is going down a particular area, because if your weight increases, then the pressure going through that exponential area also increases. So by reducing your weight, then the pressure on your knee is also less, and the chances of wear is also less.
So apart from that, are there any other do's and don'ts, doctor?
The do's for knee well-being is doing a lot of exercises for your knee, doing your quadriceps exercises, hamstring exercises. Make sure that you're keeping your weight less. So running is a good thing. Jogging, running. So I would say if you're not into running and jogging, get a step counter and try to do at least 10,000 steps a day. That's the way.
Okay. There's one question on, it's a question, general question, age of bone for 33 years old. I don't know what they meant to ask by that, but that's the question. Age of bone for 33 years old.
Age of bone for 32 years. Okay, I think basically, I think they are trying to hint at osteoporosis only. So I think you need to, as I said, to prevent any kind of osteoporosis or to improve your bone strength and other things, you need to have a very well-balanced diet, including a lot of calcium and calcium-rich food. And by doing that, you would kind of have your appropriate bone health for your bone age.
There's one other general question, doctor, which is about walking balance. So this person says walking balance, and suddenly to get up and, sitting movement and footing problem is what he has termed it as. So.
What, balance problems?
Yeah, balance, walking and even while sitting and getting up.
Yeah, I think if you're sitting and getting up, suddenly always there is a drop in the blood pressure, and that can cause balance problems. But I think if you're probably, if you're after prolonged sitting, I think you have to stand for some time before you settle.
They're also talking about walking imbalance, doctor. Does it happen, and why does it happen?
Yeah, imbalances can occur because of neurological problems, so mainly not orthopedic problems. So if you're having a balance problem, then we have to look into your neurologist.
Okay, there is this one question: is jogging on asphalt surface more impactful on our joints, causing deterioration?
Yeah, running on tarmac and asphalt can have, because you're loading your joints more. But the same thing they say with treadmill. But if you're running for half an hour a day, I don't think it makes a big difference. But if you're running for more than that, probably for long duration of time, then that can cause deterioration.
Okay. So anyone else has any questions at this point of time, because we are done with all the questions that we had. So is there anything else that anyone wants to ask? Pradeep, I will be sharing doctor's details on the chat box in a while before the session closes down.
What I would ask is, one more thing is, I would ask everybody to actually go through the YouTube thing, because I put out all these things. I think when the COVID period started off, I put out a lot of videos for general public. And I think most of the questions which everyone have asked, most of the answers, and I've also demonstrated all the exercises. For the back, for the knees, everything, all the exercises have been demonstrated. So you can just have a look at it, and then you just kind of follow that, and take my number from Shashwata or Ravi, and anytime you can just drop in a line and
yes. So I will be sharing your details now, doctor, on the chat box, so people can reach out to you and ask any questions they have. I'll share your email ID with them.
Sure.
And also the your link. Apart from that, so after this also, if you have any questions, you can send it to doctor. Okay. Thank you so much, doctor. Thank you for being here, spending an hour with us, taking the time out. On behalf of Equitas Small Finance Bank, we would like to thank you for being here and answering all the questions so patiently.
Thank you. Thanks a lot.
Thank you. Thank you so much. Thank you so much, sir.
Thank you so much, doctor. So here is the website details for who needs it. And I'll also be sharing his email ID now, so that you guys can reach out to him if you have any queries. So, yes. Thank you so much for all of you, each one of you who joined in the session. I hope you got all your queries answered. For more questions and queries that you have, I have typed the email ID and his website on the chat in the chat box, so you can reach out to him. Thank you so very much. Have a great evening.
Thank you so much, Ash. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you. Thank you so much.